may deteriorate further. So people with angina attacks will sometimes go unconscious, but not very frequently. Whereas a person with a heart attack, about 10% of people with a heart attack will go unconscious but keep breathing. But 15% of people with a heart attack will go on then to develop cardiac arrest, and their heart will stop. So this casualty is more likely to deteriorate. So what you've got to do about it when it comes to sort of treatment of this is, first of all, you ask the question when you get there, have you had anything like this before? Are you with a doctor with angina? And if they say yes, then we're going to treat them for angina first. So if they've told us they've got angina, that's what we'll treat them with. So we want to rest them in a comfortable position. Now this person, generally speaking, is a bit breathless. So what's a good position to put people in when they're struggling to breathe? What position do you like to be in if you're in bed with a chest infection? Upright. You like to sit up, there we go. So when you've got a chest infection, you go to bed, you lay flat, you can hardly breathe. So you shove some cushions and pillows under yourself, and you'll prop yourself up more in bed, and then you can breathe much better. And that's the same for this person. They will breathe much better sitting. So they don't want to be laid on the floor, they'll be laid down, they'll be sat. Now, people who are suffering angina, I've said it's normally 60 plus people. 60 plus people do have different issues as well as this. They may not be able to get on the floor very easily, they might have had knee replacements, hip replacements and everything else. They might have arthritis and all these other things. An ideal position would be to get them to sit on the floor and bring the knees up. Because sitting helps breathing, and knees up helps blood return to your heart a bit, which helps you shock. You can pack stuff under the knees. But, yeah, not everybody can make that position. So perhaps a chair that was comfortable and that had got arms on it so they don't fall out, or you stand down the side of them so they don't fall out if you can't get on the floor. But a sitting type position would be good. Reassure them plenty. And then ask them, have you already taken your medication? Have you got your medication? Have you taken it? Because what this medication does is you squirt it under your tongue. When you squirt it under your tongue, the medication gets absorbed through the mucous membranes of your mouth and straight into your bloodstream, and it makes all your blood vessels become much bigger. Because the problem, remember, is that part of your blood vessel is being obstructed by fat. So this makes them all become much bigger, and then the blood can get through to your heart and pain goes away. But what this does do, of course, when it opens your blood vessels up, it drops your blood pressure. So really people need to be taking this once they're sat down, because otherwise they might keel over and faint. And they only need to take this in a very careful, measured way. So if they've already taken it before you get there, find out how long. And if in between them taking it and a 5-minute mark, if they improve and the pain goes away, they don't need to take any more. But if they've taken it 5 minutes ago and they've still got pain, then they can take another shot of it. But if you get 5 minutes further down the line, they've had 2 shots of this, 10 minutes and still got pain, you'll have to call an ambulance because you'd expect that now perhaps to be a heart attack. So they might have had angina for a long while, but no, it's heart attack. So get them in a good position, let them take the medication. GTN spray under the tongue is what they do. 1 shot, see what happens. If they recover within minutes, there's no need to take any more. Stay with them until they feel okay, they can top off. If after 5 minutes they've not improved, get them to take it again. And if in the next few minutes they improve again, that's okay. Stay with them until they're all right. But if we've done 10 minutes, 2 shots of medication, and they're still not getting rid of the pain, then we need the ambulance. And we'll treat them as if they've got a heart attack. Which is not really a difference what we're doing. So the same symptoms, remember, the same signs and symptoms, the paleness, the sweatiness, the feeling sick, the lightheadedness, the fact that they've got this discomfort in the chest, will be exactly the same with angina as it is with heart attack. So the question again really is, ask the question, have you had this problem before, have you got angina? And this time if you say, no, I've not got angina, but they've got all these signs and symptoms, then really you've got to think it could well be a heart attack. So the best thing to do would be, very heart attack. Get an ambulance, yeah. So call for an ambulance. When you call for an ambulance, the operator at the other end will ask you the same questions as before. Is the patient breathing? Is the patient awake? Is the patient breathing heavily? And then eventually, of course, they'll say, tell me the story, and you'll say, oh, they've got chest pains and this, that, and the other. So as soon as they start to put that information in their system, they'll know that they've got to send an ambulance to you. But it's not a category 1 call at this stage, because this person is still conscious and talking to you. So they're not going to try to get here in 7 to 15 minutes. They're going to try to get here, if they can, in 40 minutes, because it's a category 2 call. So it's going to take a bit longer. They're going to see if they can source anything. If they've got no other major calls, they'll come quick. But if they've got other more important calls than yours, you'll have to wait a little bit. They'll tell you, if you can, to go and fetch your defibrillator. So they'll know, when you give them your postcode or your what 3 words, they'll know if there's a defibrillator within 500 metres. And in your case, you were saying it's at the visitor centre. Yeah, so they'll say if that's within 500 metres and you're in here, they'll say, right, your defib is at the visitor centre and this is the code that'll give you access. So they'll give you an access code so that you can send somebody down there to fetch it, whilst you stay with the patient. Now you don't need the defib yet, but remember this person could get worse. Person with a heart attack could get worse. About 15% of them are going to stop breathing, and so you need the defib just in case they do it while you're with them. So send somebody for the defib if you can. You're going to do the same as before, really. Get them in this sort of comfortable breathing position. Rest them, reassure them, keep them warm. And if tonight at 2 o'clock in the morning somebody knocks on your door, your neighbour knocks on the door and says, oh, my husband's got chest pains, he's in bed, he's not feeling very good at all, can you come and help him? I'll phone the ambulance. I'm like, but if somebody's in bed, it'll be a lot better if you can get them out of bed now while they're still conscious and sit them on the floor and cover them with a duvet. Because if they rest on the bed, they stop breathing on the bed. What can't you do very well on the bed? You can't do CPR, you just put them down with bed springs, don't you? And of course, once the person's unconscious, they're a dead weight. So to get them off that bed now and onto the floor, all the chances are you're just going to have to push them on. And if you do it, say you break a few bones, or you break a few bones. But you need them on the floor, you've got to do CPR. So if you get there and they're still conscious, with all the signs of heart attack, getting them out of bed and sitting them down will be a good thing. If they go off on you then, you can easily lay them down on the floor and crack on. So you just have to think ahead a bit sometimes as to what might happen. Because like I say, 82% of cardiac arrests happen in the home, and a fair percentage of them go out there now. What the ambulance service will suggest to you, if you've not already thought of it, is the thing that would help in this case would be if we could give the person an aspirin. Because what does aspirin do? What does aspirin do? So, thins your blood. Yeah. So aspirin thins your blood, doesn't it? So a lot of people, of course, don't carry aspirin anymore. You could say it's a bit of an old-fashioned remedy, I suppose. Used to be for pain relief years ago, didn't it? Paracetamol and things like that have taken over since, so not necessarily do people have it. But if you go to your local supermarket, you can buy a pack of aspirins for about 50p, and the ones you get from the supermarket are 300 milligram tablets. Each tablet's 300 milligrams. So if somebody's having a heart attack, you just need to give them one tablet, but they need to chew it and smash it up in their mouth. And like the GTN spray, it'll absorb through the lining and into the bloodstream. Takes about 8 minutes, and then it'll start to break down blood clots. No point swallowing it, because if you swallow it whole, it'll sit in your stomach for perhaps 40 minutes before the sort of stomach smashes it up with chemicals and it has some use. So better to chew it. You do want to ask a few questions perhaps before you give it. You do want to ask, has this person had an allergy to aspirin in the past? Because if they have, you don't want to cause an allergic reaction on top of what you've got there, do you? And you want to perhaps ask them, as your doctor said, you shouldn't take aspirin. But if they're saying, no, nobody's ever said anything to me, then taking an aspirin in this situation would be the best thing. You can't give aspirin, remember, to people under 16 because you can kill them with Graves' disease. But people under 16 are not allowed to get an heart attack, so that's not really a concern. But you can't give aspirin to people under 16. So most people now will stay as they are, talking to you, conscious, breathing distressed, signs of shock, pain, discomfort, but they'll stay conscious. And about 77% of people will stay conscious till the ambulance comes, and then the ambulance will take them to hospital and they'll pull the blood clot out and the person will be out in a couple of days. But there is that chance that before the ambulance comes, this person may go unconscious but continue to breathe. And they haven't got any injuries, because it's a medical problem. So we know what to do with them. So if they're unconscious but still breathing, the best position will be recovery position, like you've already got. So if we get to the point where they lose consciousness but still breathing nicely, this person will go in recovery. And if they get worse still and they stop breathing, then we're going to have to do resuscitation on them. So you're going to have to keep a close eye on the person whilst you're waiting. So just keep an eye on them and be prepared for the fact that it could get worse. So that's basically a bit about angina and heart attack. So anybody got any questions?